Thank you, everyone. And first of all, thank you to the American Heart Association for getting us to this point. Your leadership, again, we couldn't be more honored and privileged to be presenting sponsors. This is I think it's third or fourth year that we've been lucky enough to be in this engagement, and being back in person is just amazing. So again, Marc Watkins, and I'm going to try to advance these slides. I am not anywhere near as entertaining as Dr. Sanchez, okay? so I'm like in reverse order. You have the headline usually at the end of the show. I'm like the opening act. So let me talk a little bit about Kroger for the folks that maybe don't know who we are. And I'll go quick here, but we're the nation's largest traditional grocer. Just last year in sales alone, about $137 billion. That's not really important. What I'm going to tell you next is important in terms of the things that we've been doing not only for our 500,000 associates, but keeping in mind about what this central theme around security around food. We've talked about 90 million pounds of food rescued. So that's been really part of the things that we're doing around our Zero Hunger, Zero Waste campaign. But let me just point out that we were recently recognized as one of America's most responsible companies in 2022 because we're really working to change the way healthcare is delivered in this country. And I'm going to tell a quick story. I came on board after a long recruiting process, and we hired a new president of Kroger Health. She looked me dead in the eye, and any one of you has met Colleen Lindholt. She's about this big, but she's a firecracker, and she said to me, "Doc," and she put this death grip handshake on me and said, "We're going to change the way healthcare is delivered in this country." And I kind of went home to my wife, Deanne, who's an emergency medicine physician, and I said, "I don't know what I signed up for." But she was dead serious. And so what we've been trying to do is to really let not only America know, but our customers around the country what we're trying to do. And this is probably one of the most important slides that we have, really, because our mission is to improve outcomes by creating solutions that combine health, wellness, nutrition, connecting with people on an emotional and personal level. Because if you can't connect with folks on an emotional level, you're not going to be able to personalize the things or solutions that you want. And the story that you heard about Dr. Sanchez and his patient was about meeting her where she was. The very fact that she had proof to give to her daughters, who were never going to believe that Dr. Sanchez said you can have one drink, maybe two, which you should have said no salt on the rim, but the point that she had now proof, and she had buy-in, right? She had buy-in that, okay, they were on this journey together and understanding that this was a treat. So he met her where she was happy, and she probably went back to a very, very good regimen around her behavior after that. So our food as medicine support is really interesting. It's probably the most impactful thing I've ever worked on in my career. And what we're looking at here in this sphere is really around the center of influence of patients and customers in the middle. And we left blank, but think about this entire ecosystem represented in this room of academic partners. We also have innovation partners, health system partners, policymakers, nonprofits, all really trying to understand how we can better advance the food as medicine support. And what we're trying to do is, moving into 2023 and beyond, we actually, and just to put it in scope, in 2021, we actually sold a little bit more than 100 million scripts at our pharmacies, and we have about 2,500 pharmacies around the country. Very publicly, we've been vocal saying we want to sell less metformin in 2023. We want to sell less lisinopril in 2023, less hydrochlorothiazide. We want to replace that with a food script. We want to replace that with food as medicine. But it's going to take all of us here, right? It's just not going to be Giant, Harvard, Kroger. It won't be the Soybean Institute here and that group to do it alone. We all have to come together with AHA and others to collectively understand that food as medicine is supporting and really making it easier for people to make better choices. And that story about Dr. Sanchez, the choice is I'm going to have a margarita or two today, but tomorrow I'm back at it, right? It's okay today to do this. And so we have 5 principal pillars, and I'll just step through these very, very quickly about what we're trying to do. The first is product innovation, right? Focus on our product offerings and our unique approach. The second is research. We have outcome-driven research data that proves out food as medicine, and I'll share a little bit in that just a minute. We want the customer engagement piece to be center in what we do, really personalizing that, really making sure that we can connect with customers on that emotional level. We want partner engagement, and I love that we're aligned and we're fearless. We don't necessarily care who we partner with around our food as medicine strategy. We really want this to be rising tide, raising all ships, because we're not going to win. I was pretty much on my soapbox early this morning. Sorry to the group, my caffeine kicked in. I'm only allowed about 2.5 cups a day. And what happened was, when we're talking about things that really make it hard for folks to move this forward, and we're right here, and we're talked about obesity. If we're all not holding hands around this, obesity is replacing smoking. It has replaced smoking as the #1 modifiable risk factor for all cancer types. I know we're here talking to the AHA today, but really think about that. That's now replaced smoking. Obesity, a modifiable condition that we can control. The next is around our live our purpose, social impact. We want to make sure that we are responsible. And I'll mention a little bit about our Zero Hunger, Zero Waste campaign. We are committed to increase that by $1 billion this year. We're also increasing that by almost 30 billion additional meals that we are pledging through our Feed America campaign. These are huge pledges that we are committing with organizations in every community that we serve to ensure that we're doing our part. I mentioned Zero Hunger, Zero Waste. Here it is. And I mentioned, let me just correct that, 3 billion additional meals by 2025. And one point that I wrote down, it was in my notes, it wasn't in my prepared comments, was that we really wanted to figure out ways to augment food banks, food pantries with fresh food. This is not the food that's going to spoil and we're going to discount it and somehow try to sell it at a lower margin. We want to partner with all of our community resources to get that food to where it needs to be. And in fact, all of our store leadership, part of their professional evaluation summaries are their commitments around food as medicine. So it trickles down, not just from the C-suite, down to the division levels, to the store level, where every one of those store leaders are responsible for a Zero Hunger and Zero Waste campaign. Let's talk a little bit about Tele Nutrition. This came out of the pandemic as a way for our dietitians to reach more people. We were offering free dietitian visits via telehealth throughout the pandemic as a way to connect with our customers that maybe didn't have an ability to get to us. And this brings us to one of the points about leveraging technology in a unique way. We found a way to just meet them where they are, whether they wanted to call in, whether they wanted to use our call center, whether they wanted to sign up and come through our app, or make an appointment with our pharmacist or nurse practitioners at one of our clinics. They're able to get this done. And this got ahead of me, but the next here really talks about, in that innovation space, of how do we begin to change behavior. And we have an opt-up app. It's a proprietary app that focuses on a food scoring system. And which is different here is that we really look at the evidence-based decisions that are vital to the intellectual powerhouses that our registered dietitians are. And what we're doing is looking at the literature, and a lot of this came out of that Nouvelle scoring system that many of you heard about, but we've added an additional layer of AI support, of helping to nudge people from, we talked about this morning, red to yellow to green. So what we've done in our universe is to encourage shoppers to have less than 10% of the basket be reflected in red items. And they can simply take your cell phone, take your mobile device, scan a CPC code on the back of a product, understanding where this falls for them. They can actually personalize this, add dietary tags. If you're keto, you need to be on a low sodium diet. If you're experimenting with veganism, you can try that. If you want a Mediterranean diet, diabetic diet, put that in there and we'll guide you through that. We want 40% or less of this basket to be yellow, and we want greater than 50% of the basket to be green. As we opt you up through the pricing modality, we want to keep you in the same price point. And I think that's important for consumers, right? So just because we recommend something that's in a higher, maybe from a red to a yellow, we don't want that to break the pocketbook or the bank, right? So really keeping it price neutral and price centric, that you can opt up. And then incremental changes to support long-term behavior change. If you want a cookie, I've been scouring, I've been talking to our dietitians, find me a green cookie. Well, hey doc, there's not a green cookie there. There's a yellow cookie, it has more fiber in it. We can talk about the added sugar in it. It doesn't have any refined sugar. That might be a better cookie for you if you really want a cookie, but you're not going to get to green. But I'm not in red, okay? That's a win, right? So now I know it's going to be in moderation for those cookies that I want. But then we're able to score it. And we realize that we've had some of our studies that focus on where's that sweet spot. We believe it's about 710 that we've seen in our data that shows if you have an opt-up score anywhere from greater than 710 or higher, that we've seen positive correlation to lower A1C scores. So we know that this works. We know that if folks are watching this, they can improve their overall health. And then this is probably last that Eduardo and I talked. We didn't have a chance to talk about our SuperWin study. This is an independent randomized controlled trial we did with the University of Cincinnati, where we had 3 groups here with the primary outcome of really adherence to the DASH diet. Many of you know that as the dietary approaches to stop hypertension. What we saw in this study, with the support of a dietitian, a 6-aisle personalized education with a dietitian, and then education that was ongoing both virtually and then with coaching, was able to support a sustained lifestyle change that improved diet quality. And we measure that by the DASH score. And then we also had some impactful risks to cardiovascular risk was decreased. So those 2 there were blood pressure and then weight. So we saw a decrease there with the intervention. We were very pleased with that. More to come on the published results. But again, this just supports the activity not only of what our dietitians are doing, but them actually doing this in a area or in a location where food is being sold. Right? And that impacts behavior change, we believe, long term. This is another opportunity that I'm really pleased with. So many of you can take this back. We offer free continuing education, partnered with the American Heart Association, where we provide this as a way to enhance clinicians' training on how to utilize a grocery store for healthy eating. So this is available to any flavor of licensure that may be in this room or within your ecosystem, whether it's a nurse practitioner, pharmacist, everybody except maybe the lawyers, but the dentists and are included in this as well for their CEs as well. So again, this is free. We continue to offer that. It's about 6.5 CEs every year. We all need them if you're maintaining your license. And then finally, this is our individualized nutrition engine. And I'll just be very brief on this, right? This is a future state of a personalized engine that looks at things like consumer inputs, right? So these are your preferences, your skill set in the kitchen. What are your current needs? We do a needs assessment. We add in your goals, then we add in the data inputs that are collected, whether that's from the point of purchase or it's from claims data or pharmacy data. We want to roll that into all of the things that happen, add the engine insights that's running with our AI. I can't forget my good buddies, the dietitians, right? They have to be involved in creating what I think is the robust clinical medical nutrition therapy at that point to deliver the nutrition RX. That's the output, is really whether it's food boxes, food in general, the food they put in their basket, recipes. Those recipes have to be, like I said, culturally competent, has to meet these folks where they are. Whether it's meal planning for the family, again, whether it's a medically tailored meal for chronic kidney disease, that all supports behavior change. And that's what we're trying to do. I led with Eduardo by saying we really want to change the way America eats. We want to help people live healthier lives. It really starts with step by step creating behavior change. So thank you.